In this video, we will discuss about the levels of lymph nodes and that of the type of neck dissection. So, starting with the levels of lymph node, we have level 1 to 7. So, level 1 is divided into two groups, two subtypes, 1A and 1B. So, 1A is between the bellies of digastric, between two anterior bellies of digastric. So, it is submental group of lymph nodes that is present between the anterior bellies of digastric muscle. 1B is called as submandibular group of lymph nodes. It is present between the two bellies of digastric, between anterior belly of digastric muscle and posterior belly of digastric muscle. So, like this is the anterior belly of digastric and this is the posterior belly of digastric muscle. So, between this there is a lymph nodes that are called as submandibular group of lymph nodes, and this comes under the level 1B. So, coming to level 2. So, firstly remember second, third and fourth level together called as jugular group of lymph nodes. They are together called as jugular group of lymph nodes. Jugular group of lymph nodes. So, why they are called as a jugular group of lymph nodes? Because these lymph nodes are closely associated with a vital structure called as internal jugular vein. So, these lymph nodes are closely associated with internal jugular vein. So, that's why these are called as jugular group of lymph nodes. Level 2 is upper jugular group of lymph nodes, and level 3 is middle, and level 4 is lower. So, coming to level 2. Now, like 1A and 1B, level 2 is also subdivided into 2A and 2B. It is subdivided by a nerve called as spinal accessory nerve. Spinal accessory nerve, level 2 is divided into 2A and 2B. So, 2A is that group of lymph nodes that is present posterior superior to spinal accessory nerve. Posterior superior to spinal accessory nerve, and 2B present anterior inferior to spinal accessory nerve. 2A that is present posterior superiorly, and 2B that is present anterior inferiorly to the spinal accessory nerve. And what are the boundaries? Level 2. So, level 2 starts from skull base to carotid bifurcation. To carotid bifurcation. Now, coming to level 3. So, level 3, as we discussed, it is a middle jugular group of lymph nodes. Middle jugular group of lymph nodes. So, level 2 was from skull base to carotid bifurcation. Level 3 is from carotid bifurcation to the omohyoid muscle. Carotid bifurcation to omohyoid muscle, we have middle jugular group of lymph nodes, that is level 3 lymph nodes. So, this is second group, upper jugular, and this is third group, that is middle jugular, that is present from the carotid bifurcation to the superior belly of omohyoid or the omohyoid muscle. So, level 4 is lower jugular group of lymph nodes. So, it is present from the, so where we ended, level 3 was from carotid bifurcation to omohyoid. So, level 4 is from omohyoid muscle to clavicle. So, level 2, 3 and 4, these are the jugular group of lymph nodes associated closely with the internal jugular vein. So, coming to the level 5. Level 5 are the nodes that are present in the posterior triangle. So, what will be the boundaries? So, posteriorly there is trapezius muscle and anteriorly there is sternocleidomastoid muscle, and level 6 the nodes that are present in the anterior triangle, and level 7 is the mediastinal group of lymph nodes. So revising all the levels of lymph nodes, so we study that for 1A, that is a submental group of lymph nodes present between the anterior bellies of digastric, and level 1B, that is a submandibular group of lymph nodes present between the anterior belly of digastric and posterior belly of digastric. So level 2A, that lies posterior, this is level 2A and 2B. These are the upper jugular group of lymph nodes. 2A, that is posterior superior to the spinal accessory nerve, and 2B, that is anterior inferior to the spinal accessory nerve, and these are present from the skull base to the carotid bifurcation. Coming to level 3, it is a middle jugular group of lymph nodes. So middle jugular group of lymph nodes present from the carotid bifurcation, to the omohyoid muscle. So this is the superior belly of omohyoid, and this is the inferior belly of omohyoid. This is the superior belly of omohyoid muscle, and this is the inferior belly of omohyoid muscle, and this is sternocleidomastoid muscle, and this is trapezius. So here present the second group of lymph nodes, third, that is middle, and this is a lower, that is level 4 is from omohyoid muscle to the clavicle, omohyoid to clavicle. So level 5, as we discussed, level 5 nodes in the posterior triangle, that is, this is sternocleidomastoid and this is trapezius. So here will be the level 5 group of lymph nodes, and level 6 that are present in the anterior triangle, and level 7, that is the mediastinal group of lymph nodes. Now coming to the types of neck dissection. So we broadly classified into 3 types. First is a radical neck dissection, second is a modified radical neck dissection, and third one is a selective neck dissection. Radical, modified and selective. Another type of classification is that the neck dissection may be prophylactic type or the therapeutic type. So firstly we will discuss about the radical type of neck dissection. So radical type of neck dissection was firstly described by Kreil in the year 1906. So it is also called as a Kreil's method of neck dissection. So in this type of neck dissection we will remove level 1 to 5 group of lymph nodes plus submandibular gland plus submandibular salivary gland along with 3 vital structures, that is spinal accessory nerve, internal jugular vein and one muscle, that is sternocleidomastoid muscle. So this is a radical neck dissection. Now coming to the modified radical neck dissection. So it is divided into, or subtypes are MRND 1, 2 and 3, that is modified radical neck dissection. The main purpose is that we remove the same, like 1 to 5 group of lymph nodes are removed also in the modified radical, but we preserve, the difference is that we preserve one of the vital structure. In MRND 1 we preserve spinal accessory nerve. In second subtype we preserve spinal accessory nerve along with the internal jugular vein. So internal jugular vein, and in third spinal accessory nerve plus internal jugular vein and the sternocleidomastoid muscle. So we preserve all types of all vital structures in MRND 3. In selective neck dissection we preserve 3 of them also in selective neck dissection. So what's the difference, we will discuss later. But MRND3, it is called as a functional neck dissection and it was described by Boca. Radical neck dissection was described by Cryle, and MRND neck dissection, that is a third subtype, is called as a Boca's dissection or the functional neck dissection. Here we preserve all of the vital structures. In selective neck dissection, here we selectively remove the lymph nodes, but we preserve all of the vital structures, that are the sternocleidomastoid muscle plus internal jugular vein and spinal accessory nerve. So we have subtypes of selective neck dissection also. So subtypes include, first we have supraomohyoid type of selective neck dissection. So as we study in the levels of lymph node, that from the carotid bifurcation to omohyoid, this is level 3. Level 4 is from omohyoid to clavicle. So that's why here we remove level 1, 2, 3 plus submandibular gland, because it is supraomohyoid, that the lymph nodes are removed that are superiorly present to the omohyoid muscle. So level 1, 2 and third group of lymph nodes come under this, that is superiorly to the omohyoid muscle. Now the second subtype is extended supraomohyoid type of neck dissection. So there is extended supraomohyoid type of neck dissection. So here we remove fourth group of lymph nodes also. Then third subtype is lateral neck dissection. So lateral neck dissection, here we remove level 2, 3 and 4. We don't remove first level, because as we know, first is submental and the submandibular group. We remove second, third and fourth type. And then comes a posterolateral type of selective neck dissection. Here we remove second group of lymph nodes, third group of lymph nodes, fourth group of lymph nodes and fifth. We don't remove first and sixth one. Then comes a central type of neck dissection. We remove sixth group of lymph nodes, that are nodes present in the anterior triangle. So this was all about the radical neck dissection, modified radical neck dissection and selective neck dissection. So what's the meaning of prophylactic and the therapeutic neck dissection? So prophylactic, like in thyroid cancer, we prophylactically remove the lymph nodes that are not, it means that are not involved in the malignancy, but as a prophylactic measure we remove the lymph nodes like cervical lymph nodes, but these nodes are not clinically palpable or radiologically detected. Therapeutic, like for the purpose of the, like lymph nodes are involved in malignancy and these are also clinically palpable and radiologically we can see the involvement of the lymph nodes. So there's one procedure called as a commandos operation. So commandos stand for combined mandibular neck dissection. So combined mandibular plus neck dissection, that is, here we remove the total glossectomy, removal of whole tongue, plus hemimandibulectomy, removal of half of the mandible, plus we remove the cervical lymph nodes. Cervical neck dissection, we remove the cervical lymph nodes. So combined mandibulectomy along with the neck dissection. So this is commando operation usually done in the carcinoma of the tongue. So what are the complications of the commando's operation? So there can occur a nerve injury. So most commonly nerve that get injured is a marginal mandibular nerve. So there will be drooling of saliva. Drooling of saliva. So second complication is there may be injury to the spinal accessory nerve. So it will lead to pain and shoulder dystrophy. And third complication can occur, that is carotid artery blowout. So thank you.